What if the vitamins you're taking every day, the ones you think are helping you, are actually doing more harm than good? I've seen it over and over in my 25 years as a doctor. Seniors over 60 walking into my office exhausted, foggy, or battling joint pain, and the cause isn't always aging. Sometimes it's the wrong vitamin at the wrong time, or even worse, too much of a good thing. Because here's the truth. After 60, your body changes. Your kidneys, liver, absorption rates, and heart all respond differently. And what works at 30 or 40 might be dangerous by the time you hit 65. So in this video, we're diving deep. The 4 vitamins I tell my patients to stop taking immediately, and the 4 I recommend almost every senior add to their routine daily. No guesswork, no fluff, just real practical advice from someone who's treated thousands of older adults. Let's begin with the first supplement you may want to toss in the trash. Dangerous vitamin 1, high-dose vitamin A, retinol. It surprises most of my patients when I tell them this, but vitamin A in high doses can quietly do more harm than good for people over 60. Let me explain. Vitamin A is essential. It helps with vision, immune support, and skin health. But the form you take and the dose matter more than you think. Many multivitamins contain retinol, a synthetic or preformed version of vitamin A. In large amounts, especially over time, it becomes toxic to the liver, and seniors are far more vulnerable to this buildup. I had a patient once, a 72-year-old man who started losing his appetite and feeling fatigued. His blood work showed elevated liver enzymes. No alcohol, no medication changes. Turned out he was taking a high-potency multivitamin with over 10,000 IU of retinol every day, and had been for months. That's the problem. Vitamin A doesn't just flush out. It stores in your fat and liver, and at high levels, it can thin your bones, increase fracture risk, and stress your liver silently. My advice? Skip high-dose retinol unless your doctor prescribes it. If you need vitamin A, choose beta-carotene from food sources like carrots, sweet potatoes, or a safe plant-based supplement your body can regulate naturally. Dangerous vitamin 2, vitamin E, in synthetic form, D-alpha-dicafferol. Vitamin E is often marketed as an anti-aging miracle, good for your skin, heart, even your immune system. But not all vitamin E is created equal, and the form most people take might be doing more harm than good. Many cheap multivitamins and supplements use a synthetic version of vitamin E labeled as D-alpha-dicafferol. It's not the natural form your body expects, and here's the issue. In high doses, especially when taken daily, this synthetic version has been linked to an increased risk of stroke and even prostate cancer in several clinical studies. More importantly, vitamin E is fat-soluble, meaning it's stored in your body. That sounds like a benefit, until you realize that it builds up over time, especially in older adults whose livers don't filter as efficiently. That slow buildup can affect blood clotting and even interfere with medications like statins or blood thinners. Natural vitamin E, labeled as D-alpha-dicafferol and paired with mixed tocopherols, is a better choice, but even then, dosage matters. My advice? If you're over 60, avoid synthetic vitamin E entirely, and only take the natural form if you've been advised to by a doctor who knows your full history. Dangerous vitamin 3, high-dose iron, when you don't need it. Iron is essential for energy, oxygen transport, and red blood cell production, but after 60, more isn't always better. Here's what most people don't realize. Unless you've been diagnosed with iron deficiency anemia, taking extra iron daily can quietly become harmful, for 13, especially for older adults. Why? Because iron accumulates in the body. Your body isn't great at getting rid of excess iron, and over time, that buildup can damage vital organs. I've seen it affect the liver, heart, and even the brain. It's called iron overload, and in seniors, it's more common than people think, especially among men and postmenopausal women who no longer lose iron through menstruation. Too much iron increases oxidative stress, a key driver of aging, inflammation, and chronic diseases like heart failure and neurodegenerative conditions. The real danger? Many multivitamins still contain 18 milligrams or more of iron, designed for younger menstruating women. Seniors taking these without knowing their actual iron status may be setting themselves up for long-term damage. If you're over 60, never supplement iron blindly. Get your iron levels tested first, and only take it if your doctor confirms you actually need it. When people think about aging bones, calcium is usually the first thing they reach for. But too much calcium, especially from supplements, can quietly harm more than it helps. Let me tell you about Carol. She's 69, active, eats well, and wanted to stay ahead of osteoporosis. So she added 2 calcium pills a day to her routine, thinking more was better. By the time she came to see me, she was experiencing constipation, bloating, and more worryingly, occasional chest discomfort. Blood work and a calcium scan revealed elevated calcium levels and early signs of arterial calcification. The same calcium she was taking to help her bones was now lining her arteries. Here's what I told her, and what I tell all my patients. Your body can't always direct excess calcium to your bones, especially without enough vitamin K2 or magnesium. That calcium can wind up in places you don't want it, like your blood vessels, kidneys, or joints. For most seniors, calcium from food, like leafy greens, sardines, yogurt, is safer and more absorbable. Supplements, only if you're truly deficient, and never without supervision. Essential vitamin 1, the backbone of senior health. If I had to choose just one vitamin to recommend to nearly every patient over 60, it would be vitamin D3. Here's why: as we age, our skin loses the ability to synthesize vitamin D from sunlight. Combine that with less time outdoors, and you've got a perfect storm for deficiency. And low vitamin D in seniors isn't just about bones, though it absolutely weakens them. It also affects mood, memory, immunity, and even muscle strength. One study found that older adults with healthy vitamin D levels had a 40% lower risk of falls, fewer infections, and better cognitive performance than those who were deficient. But I don't just go by the numbers, I've seen it firsthand. When my patients start supplementing with 1000 to 2000 IU of vitamin D3 daily, alongside proper magnesium and K2, they often report better sleep, fewer colds, and steadier energy. The key is D3, not D2, and checking your blood levels once or twice a year. Too much can be harmful, too little is useless. But get it right, and vitamin D becomes a quiet powerhouse in your daily routine. Essential vitamin 2, magnesium, the great calmer. Most seniors I see don't realize they're magnesium deficient, but once we correct it, the difference can feel like night and day. Magnesium supports over 300 processes in the body. It regulates your heartbeat, helps control blood sugar, keeps your brain sharp, and most importantly for seniors, it calms the nervous system and relaxes muscles. That means better sleep, fewer cramps, and less anxiety. I remember reviewing a food log from one of my patients, Jim, 73. He ate well, whole foods, veggies, some fruit, but he was constantly dealing with muscle twitches, insomnia, and irritability. Turns out, even a healthy diet can fall short on magnesium, especially when you factor in medications like diuretics, which flush it out. Once we added 200 to 400 milligrams of magnesium glycinate daily, his symptoms faded. He was sleeping through the night again within 2 weeks. The 4 matters: avoid magnesium oxide, poorly absorbed, and go for glycinate, citrate, or malate, depending on your needs. And remember, 858, magnesium isn't just a mineral. For seniors, it's a daily tool for calmer nerves, smoother sleep, and stronger aging. Essential vitamin 3, vitamin B12, for energy, focus, and nerve health. If you're over 60, there's a high chance your body isn't absorbing enough vitamin B12, even if you're eating meat or dairy. And that's a problem, because B12 is absolutely critical for maintaining brain function, energy levels, and healthy nerves. Here's why: as we age, our stomach produces less stomach acid, which is required to release B12 from food. That means even if your diet includes B12-rich foods, it might not be getting absorbed. A large-scale study published in the American Journal of Clinical Nutrition found that nearly 1 in 3 adults over 65 had low or borderline B12 levels, and most didn't know it. The symptoms: fatigue, memory lapses, numbness in hands or feet, things many seniors chalk up to just getting older. But here's the good news. B12 is easy to supplement and generally safe, even in higher doses. I recommend methylcobalamin or hydroxycobalamin forms, not cyanocobalamin, for best absorption. And if you're plant-based or on acid-reducing medications, you're at even higher risk, and supplementation is even more important. A simple blood test can confirm your levels. But for most seniors, a daily B12 supplement is a no-brainer for protecting energy, memory, and mobility. Essential vitamin 4, omega-3 fatty acids for your brain, heart, and joints. Okay, technically omega-3s are fatty acids, not vitamins, but for seniors, they're just as essential. And sadly, most people over 60 don't get nearly enough. Here's what I always tell my patients. Omega-3s aren't just good fats. They're anti-inflammatory powerhouses that protect your brain, heart, joints, and even vision. They help keep your blood flowing, reduce stiffness, and support mood and memory. A landmark review in The Lancet showed that older adults with higher omega-3 levels had significantly lower risks of heart attacks, slower cognitive decline, and better mobility. But these fats are hard to get from diet alone unless you're eating fatty fish like sardines, mackerel, or wild salmon several times a week. For most seniors, a daily omega-3 supplement, ideally with EPA and DHA, is a smart move. I usually recommend 1000 mg combined EPA/DHA daily. Just make sure it's from a reputable, purified source to avoid mercury. The best part, omega-3s are gentle and well tolerated, and their benefits touch almost every part of the body. If there's one supplement I've seen improve both how people feel and function, it's this one. And there you have it, the 4 vitamins and nutrients I recommend most often to my patients over 60, and the one that almost always surprises people as being potentially dangerous. Remember, aging doesn't have to mean losing energy, memory, or mobility. The right nutrients in the right forms can make a profound difference in how you sleep, think, and move. But here's the key, don't guess. Work with your doctor, check your levels, and build your supplement routine around what your body actually needs. At this stage in life, every choice matters. If you found this helpful, tap the like button and subscribe to Vital Steps for weekly videos on senior health, always grounded in science, delivered with care, and made to help you thrive. Your health is your legacy. Let's take the right steps together.